So good morning. Good morning, honorables and distinguished delegates, dear civil society colleagues, and powerful women advocates and gender equality champions. I speak on behalf of Women for a Global Fund. We are a feminist movement of 250 women advocates from 62 global South countries. And today I'm really honored to be sharing with you the results of a multi-country, a multifaceted consultation we did along with ICW here present also with us, Immaculate. I will be presenting the key findings of the consultation in 10 Sub-Saharan countries, but moreover, I will be presenting key recommendations on how important it is for us to rethink gender equality and meaningful participation and engagement of women in all of our diversity in the gender equality processes that we are conducting currently along with the Global Fund and the Grand Cycle 7. And I also take this opportunity to remark that we're currently commemorating the 16 days of activism against gender-based violence. And let us remember that discrimination and stigma towards women living with HIV is also gender-based violence. So I'm going to start by saying, and probably I would just use the stage a bit more and see my colleagues here, that despite the increased commitments that we have from the Global Fund and other processes regarding meaningful engagement of women, there is still a lot of challenges we are facing. So that's why ICW and Women for Global Fund conducted a multifaceted approach consultation in order to understand which are these challenges, which are these barriers that we are facing as women in diversity in the current Grand Cycle 7 process. And so that's why we make this process a technical consultation, and we also had interviews process, such as briefing surveys and the online consultation. And here we come with the main results. Please, the next slide. So here we can see that we have data collected and gathered from 53 respondents in total in 10 Sub-Saharan countries. And these countries were Cameroon, Eswatini, Ghana, Kenya, Nigeria, Malawi, Tanzania, Uganda, Zambia, and Zimbabwe. But this is like a part of an important process we were also conducted at global level, and we have around 23 other countries from the different sub-regions, including Latin America, Caribbean, Asia Pacific, North Africa, Eastern Europe. So this is a process in which we are working collectively, and the main results of this consultation just show that there are still lots of challenges women are facing when trying to engage in the Global Fund processes. So this consultation included some areas that we want to share with you. Sorry. And we talk about gender priorities, which are women's needs, specifically for participation. What are the things that are included and not included in the funding requests, and what are our expectations? Please, the next slide. So it is really important to remark that in the previous Grand Cycle of the Global Fund, out of 46 funding requests that were presented, only one had and used a gender assessment analysis for the proposal. And this is really alarming, considering that gender assessments are the most important elements for really putting into practice and implementing which are the needs of women and the diversity in the funding requests of the Global Fund. We know that very few respondents of our consultation really confirm being part of this process, and this is also really alarming, considering that majority of women that we interview and we consult indicated not being satisfactory included in the process, on the dialogue process of the Grand Cycle 7. So can we just can I go to the next slide, please? Yeah. So just remembering also how important it is for us to understand which are these barriers. Some of them also included and indicated that many of these are regarding economic barriers, social also discrimination and stigma. They are not invited to the decision-making process, and even if they are present in some of the dialogues or some of the meetings, when there's a moment to really decide where the funds go and where and who is going to implement the process and the activities, women were indicated that they were left behind and that their voices were not considered into project implementation or in the funding process. So that's a real concern we also with ICW present today now, indicating how important it is not only to invite women to be part of the process, but really consider their meaningful participation and engagement in this. So many priorities also in these countries. For example, we see that there are some progress, specifically, for example, in Nigeria. We also have some women also in Ghana that were part of the CCMs. And in Eswatini also, they participate in the proposal writing, and they were engaged in the country level dialogues, and they benefit also from technical assistance provided by the Global Fund and the CRG department, but still challenges are present. And as we were saying in different sessions also in this conference, I think it's relevant to indicate that many women participate on a voluntary basis, and they need to really leave their jobs or their daily tasks to be there. And this needs to be considered as a priority for the Global Fund and other CCMs to really consider and valorize the expertise of women living with HIV and women-led organizations. Please, the next. So as conclusions, we know that the Global Fund has made powerful commitments to gender equality and equity, community participation, and human rights. However, it's more urgent than ever that we prioritize women's needs with the Global Fund framework, and this considering the current and difficult situations and criminalization of women and the diversity. And we have concerns also about the transparency, accessibility, and representation of these community leaders and women-led organizations on the CCMs and on the Grand Cycle 7 process. It is mandatory for us to think and rethink on the CCMs we really want to create and redesign as civil society organizations, and we put into evidence how important it is for us to advocate with data, with information collected from the ground, as we did together with ICW. Clear and transparent decision-making procedures are really important, and we need to enhance the accessibility for all and broaden this representation across all stages of engagement, because they are really essential to ensure effective participation and to elevate women's perspectives. We really also must address the cycle where the lack of influence of accountability in prioritization processes has led to underfunding women-led organizations and women and transformative gender actions in the national levels. So we really need to focus and see how can we transform data we collect from the ground into actions, into powerful actions to have gender equality, not only in the Global Fund, but in the national responses to HIV, tuberculosis, and also malaria. The next one, please. And final recommendations. Also, we know that there are many challenges, but we encourage to think and use the information provided and gathered by civil society organizations and women-led organizations to really advocate with evidence-based information. We need to ensure meaningful participation of women living with HIV in all the stages of the Global Fund processes, and this includes promoting and funding gender assessments in the different countries, and use these elements and tools for programming implementation and also evaluation of how we are doing and how we're going with the processes at the national level. We also need to empower networks of women living with HIV, so we use this information for priority interventions and support gender transformative actions and initiatives. We need to strengthen women's representations and voice within the Global Fund's country coordinating mechanism, but we need to reshape, we need to rethink, and collectively we need to shape the CCMs we really want for our future, considering that women-led organizations and women in diversity sometimes, and most of the times, as we have seen in the consultations, are left behind. And more research is needed. So we call on stakeholders and other actors to support this kind of research and use the information and the data that we already have and produce a bit more of them, so we can collectively have information that can produce changes for gender equality, and as we say, also leave no one behind. I thank you very much for the opportunity of being here, and I leave the floor to the next panelist.
Thank you, Angela.